So hello, good evening everyone. Today I will be assessing our patient's breast and axilla. So the goal of this examination is to determine if the breast is normal or abnormal. If abnormal, any or all of the following may be indicated. So if there is abnormalities on the breast, we will be performing surgical consultation, re-examination at different time of the menstrual cycle, and then we are also going to do mammograms if there is breast cancer on our patient, and also possibly ultrasound. So the purpose of this examination is to discuss the importance of preparing clients prior to breast and axilla examination, explain the two methods of examining the breast and the axilla, and then to explain the significance of a selected breast and axilla findings, and then to enumerate the steps in performing breast and axilla assessment. So first we're going to prepare all the materials that we need so that we can render efficient and quality care to our patient, and so that the materials that we will be using is accessible in the areas to save time and effort. So we will be needing gloves in this assessment, but if possible, we should not be using gloves so that we can palpate effectively or accurately on the breast of our patient. But we need to protect ourselves sa if there is infectious discharge on the patient's breast, so we will be needing the gloves. Then next is, so these are the things that we need to remember in performing the breast and axilla examination. So, as what I've said kanina, it is better not to wear gloves while palpating the breast, because it reduces the ability of our hands to fully appreciate all the features of a lesion. And then, it is advisable for male examiners to have a female chaperone assist during the examination. So if it is a male nurse who is assessing a female client, so we need a female chaperone so that we can testify or witness the examination, since it could be something malicious, or just so someone will be watching while doing the examination. Then the worst moment to perform a breast exam is right before the beginning of the menstruation, when most of the benign lesions are more painful and bigger, making it difficult to differentiate between them and the malignant masses. So it is difficult to assess the breast, since the client may be experiencing swollen breast due to the menstruation. So it is important that we examine the breast after or a few days after the menstruation. Next is, it is important to educate the patients to distinguish between normal and abnormal findings on self-examination. So now we're going to wash our hands so that we can avoid the transfer of microorganisms. So if ever the washing area is far from your location, you can use the alcohol to sanitize our hands. And then we're going to wear on our gloves so that we can protect ourselves from any infectious discharges from our patient. Now we're going to explain the procedure to our client. So it is important that we explain the procedure to our client so that we can foster rapport to our patient, and then so that the patient will know what are the what are the things that we're going to do to the patient's body, so that the patient will be aware and he will know how to cooperate during the assessment. So tonight we have here Miss Manny to join us with our assessment. Okay. Now that we are done doing the preliminaries, we are now going to inspect the breast. We're going to take off the clothes of our patient. That's why we need privacy in doing the procedure, because we are exposing sensitive and private part of the patient's body. And so that we need privacy so that we can maintain the patient's dignity as a human being. Okay, now we're going to take off the patient's cloth. Okay. So now we're exposing the patient's kanang breast. Okay, so first we're going to inspect the breast for size, symmetry, and contour or shape while the client is in a sitting position and disrupt to the cloth. Okay, so now our patient has no cloth, so we're going to inspect for the size and the symmetry of the breast while our client is sitting. Okay, so I can't make her sit. Okay, so the normal findings of this is that for female, the size of the breast, the shape of the breast is rounded, is slightly unequal in size, generally symmetric. So it is normal for the breast to not be symmetric, to be for instance, like the other breast is bigger than the other breast. So that is normal. And then for male clients, breast even with the chest wall, if obese, may be similar in shape for female breast. Okay. So if our client is obese, so there is a similarity of the breast with the female because of the fats on the breast are increasing due to its condition, obesity. Okay. Then the deviation from normal is that there is recent change in the breast size, swelling, and marked asymmetry. So the deviation from normal is that there is swelling on the breast, and then due to the swelling of the breast, there is asymmetry, or the unequal breast is very evident. Okay, that is the deviation from normal. Okay, so during the inspection of the breast, observe for any asymmetric findings, especially if we observe some abnormalities in the overall shape of the breast. So we should take note of the changes in the skin color, skin dimpling, retractions, or spontaneous nipple discharge. So if we observe some discharge on the nipples, we should take note of it because this could be a sign of breast cancer. Now with the arms at the sides, note for the following: color, thickening of the skin in unusual prominent pores, size and symmetry of the breast, contour of the breast. So while our patient is sitting, we're going to ask our patient to put its arms on the side, and then we're going to observe the color, if there is any thickening of the skin, and then if there is unusual or prominent pores on the breast, and then the size and symmetry of the breast and the contour of the breast. Okay. So the color is the deviation from normal is that there is redness from local infection or inflammatory carcinoma. And then if there is thickening of the skin in unusual prominent pores which may accompany lymphatic obstruction. So thickening and prominent pores suggest a breast cancer. So we should observe all this signs that are mentioned so that we can gather accurate information towards our patient's condition. Okay, next is we're going to inspect the breast for localized discolorations or hyperpigmentation, retraction or dimpling, localized hypervascular areas, swelling or edema. So we should observe for any edema or swelling on the breast, or if there is discoloration or hyperpigmentation on the breast. Okay, so the normal findings of this is that there is uniformity on the color of the breast, and then it should be smooth and intact, and there should be, or if there is any presence of striae, especially for our patients who are obese and then they have lose some weight, so the striae or stretch marks is evident on the chest area. And then if there is any moles or nevi, so moles are either are persons who have moles on the breast, so that is normal. And then the deviation from normal is that there is localized discoloration or hyperpigmentation. So if we observe some of these signs, we should take note of this. And then there is retraction or dimpling on the sides of the breast or on the nipple. And then there is unilateral localized hypervascular areas, swelling or edema. So hypervascular areas is that the veins of the breast is evident. And then there is swelling or edema appearing as pig skin or orange peel due to exaggeration of the pores. So orange peel like kana ang naa siya murag mga pores bitaw na more siya nag-inflame na pores. That's what we call the orange peel, exaggeration of the pores. Okay, so bright redness of the breast, tenderness and warmth, especially in lactating women with fever, may be signs of mastitis, a fairly common presentation. Okay. So kato ang magiging ganiha nga katong orange peel, this we also call that PUD orange. Katong orange peel nga sign of kanaang mastitis. Okay. Now we're going to inspect the areola area for size, shape, symmetry, and then color, surface characteristics, and any masses or lesions. Inspect the nipples for size, shape, position, and color, discharge, and lesions. So we're going to inspect the areola and the nipple. So the areola is inside the nipple. And then the normal findings is that the nipples should be rounded or oval, bilaterally the same on both breasts, and then color varies from light pink to dark brown. For light skin patient, it could be pinkish or light brown, and for dark skin patient, it could be dark brown. So, irregular placement of sebaceous glands on the surface of areola. So, there is sebaceous glands, irregular placement on the areola. So, the deviation from normal is that there is any symmetry, mass, or lesion, or if the nipple is everted or retracted. That is a deviation from normal. Now we're going to ask our patient to move its arms over its head, and then hands pressed against the hips, leaning forward, and then ask the patient to raise her hands over her head, and then press her hands against her hips to retract the pectoral muscles. So this position is to bring out the dimpling or retraction that otherwise be invisible. So you have to ask our patient to move its arm over its head, and then towards its hips, lean forward. This is so that we can we can see any dimpling or retraction on the breast. So this is the best position to see the dimpling or retraction on the breast. So if the breasts are large or spondylous, it may be useful to have the patient stand and lean forward